Thanks for joining us today. Welcome to the Center for State's video series on the 7 functions of intervention selection and design adaptation. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. In this module, we will discuss how to further define and operationalize interventions, specifically how to adapt or design practice profiles for interventions. As a reminder, teams should have already researched possible intervention options and assessed the evidence, fit, and feasibility of an intervention, determined whether to replicate, adapt, or design a completely new intervention, then defined it for stakeholders and developed a proposal, designed the core components as needed to further operationalize the intervention as well. A practice profile is a valuable tool for defining the intervention. Teams create practice profiles to describe how an intervention works in everyday practice, making an intervention teachable and doable. Practice profiles identify the expected behaviors that will guide the staff who deliver the intervention and structure training and coaching to achieve the practice. They also guide assessment of fidelity to an intervention model and interpret the outcomes achieved, as well as promote continuous improvement. If a selected intervention is well operationalized and expected behaviors are clear, then teams may not need to develop new practice profiles. When teams are adapting a well-defined intervention, they may be able to adapt the existing practice profiles to their setting. If the interventions are not well-defined, or if they are being newly designed, implementation scientists recommend creating practice profiles to support planning, implementation, and evaluation. Practice profiles typically include 3 major elements: core components that reflect underlying philosophy and principles, core activities related to the components, and expected behaviors that explain how to carry out the core activities. Practice profile development builds from teamwork on defining and operationalizing the core components of an intervention and aligns with the guiding philosophy and principles of the intervention. Teams should consider coordinating a sub-team to draft practice profiles using 3 steps. Identify core components and core activities. As described in earlier modules in this series, teams should have identified core components and related core activities that represent observable actions that workers perform. Specify behaviors and staff requirements. From the core activities, teams will identify practice indicators, or behaviors and actions, that describe exactly how workers will perform the core activities during implementation. These should be observable and measurable behaviors, so someone watching can tell if workers are performing the activity successfully. And then review, test, and revise the practice profiles. Following initial development of the practice profiles, teams should vet those with the leadership, workers, community members, program representatives, consultants, evaluators, and other key stakeholders. These groups can provide valuable knowledge and insight that can improve the profiles and make them more useful, and including evaluators in the process helps connect the practice profiles to fidelity measures for the overall intervention. Typically, practice profiles present expected behaviors on a continuum from beginner or in development to mastery that accounts for different skill levels, and provides an opportunity to structure coaching and training to improve skills and can support guiding contracted service providers in their work with the intervention. Let's walk through an example of this continuum. Expected behaviors are the highest level. They show that staff have required skills and abilities and consistently apply them to a wide range of settings and contexts. An example of this is consistently reflects back to others what they are sharing. Developmental behaviors are the middle level. They include behaviors that show staff have required skills and abilities, but that they apply them inconsistently or in a more limited range of contexts. Example, reflects back to others what they are sharing about half of the time. Unacceptable. The lowest level includes behaviors that show staff have not yet acquired required skills or abilities in any context. Staff may in fact be doing the opposite of what is intended. The example is they rarely reflect back to others what they are sharing. When staff or service providers are unable to achieve the expected behaviors, the profiles and continuum can also help identify system barriers or other challenges that they may be able to address. While practice profiles clearly establish the specific practice behaviors that will help achieve the expected outcomes of an intervention, it's also important to consider relevant policies, guidelines, infrastructure, training, coaching, and other supports that will ensure that the intervention is implemented and sustained effectively. Teams who are adapting or creating practice profiles should consider the following together. Do the practice profiles outline the core components, the related core activities, and describe the expected behaviors for performing the core activities? Are the behaviors presented in observable and measurable terms on a developmental continuum? Will the practice profiles be tested and reviewed before using them? Do they support training and coaching, guide practice, and support continuous improvement? When teams consider these when adapting or creating practice profiles, they will be more likely to create profiles that are clear to those who supervise and practice the intervention, that will be accepted by staff, and guide supervision and coaching for continuous improvement. While selecting and planning to adapt or design an intervention, teams will find it useful to keep in mind their readiness in 5 dimensions of organizational capacity. Resources. Does the agency have sufficient fiscal and staff resources in place for planning, implementing, and evaluating the selected intervention? Are there existing program materials and guidelines, or will they need to be developed? And what will that require? Engagement and partnership. Who are the child welfare system partners and community stakeholders who should be involved in replication, adaptation, and/or design and evaluation of the intervention? Infrastructure. How does the selected intervention fit with the existing child welfare system and agency infrastructure? What potential changes will be needed in organizational policies, protocols, information management systems, and processes to support implementation? Is there a communication plan for the intervention? Knowledge and skills. Does leadership have knowledge of potential adaptive challenges related to implementing the intervention and skills to address them? Do managers have knowledge and skills to effectively promote and manage change? Does the agency have staff with knowledge and skills needed for the intervention? What are the implications for recruitment, selection, training, and coaching? Culture and climate. Does the selected intervention align with agency culture? Does agency leadership support the intervention? Is there staff buy-in for the intervention? Can leadership promote a true commitment to the intervention? And can the agency shift old habits to embrace the intervention? Teams will consider many of these factors in more depth as they assess readiness and continue planning in later phases of their change and implementation process. Before teams move ahead with implementation planning and capacity building, let's check in on a few key milestones teams should have in place. A team with diverse expertise and representation to guide the change and implementation process is in place. The team has a clearly identified problem and an analysis of the root cause or causes of the problem. A theory of change that reflects a clear pathway from the problem to a desired long-term outcome has been developed. And they have identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and is feasible within the agency's system. Taking the time to ensure that these key milestones are in place before moving into implementation planning and capacity building will increase the likelihood of successful implementation of the change initiative. Let's take a moment to check in on what you've learned about adapting or designing practice profiles. Why do teams adapt or design practice profiles? to describe the everyday practice of an intervention, support training and coaching to a desired practice, and help measure fidelity and performance outcomes. How do teams adapt or design practice profiles? By ensuring they include the three major elements and specify the expected behaviors at the practice level on a continuum to account for different skills, settings, and contexts. What can help teams adapt or design practice profiles? Describing expected behaviors on a developmental continuum and taking time to review and test them before implementing. Now take this a step further by reviewing the reflection questions and practice exercise for further operationalize intervention as needed, adapt or design practice profiles in your intervention selection and adaptation design workbook to connect what you've learned to your own experience. As a recap, the modules in this video series on intervention selection and design adaptation include research possible intervention options, assess fit, evidence, and feasibility of possible interventions, determine whether interventions are well defined or usable transferable, decide to replicate or adapt an existing intervention or design a new one, define the intervention, develop a proposal, and then further define and operationalize the intervention as needed. Feel free to go back and rewatch any of the videos in this series to refresh your memory. Remember to use the Intervention Selection and Design Adaptation Workbook to reflect on your learning, record any outstanding questions, and think through your next steps. Join us for the other videos in this series to learn more about the essential functions for each part of the change and implementation process.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.